Before we get into it, I want to remind you about our other PD Health at Home virtual programs. Each week, we offer sessions tailored to support people with Parkinson's and their care partners, including Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, and expert briefings, as well as our Spanish language series, Y Salud en Casa. Be sure to visit our website by scanning the QR code on the screen with your smart device to see what's coming up and to explore our archive videos on YouTube. Please join us for our annual Care Partner Summit on Saturday, November 8th. This year's theme is Caring with Confidence. We'll explore how care partners can strengthen identity, set boundaries, communicate effectively, and maintain your own well-being. We'll feature 5 care partner panelists to share about their lived experience across the board of newly diagnosed, women with Parkinson's, advanced, and through the stages of end of life. Learn more and register to attend the live event or to receive the recording at parkinson.org/care summit. The Parkinson's Foundation is aware that navigating medical appointments with Parkinson's can feel overwhelming, especially when time is limited and priorities compete with one another. Our Optimizing Care initiative emphasizes the importance of what matters to you, ensuring your voice, your story, and your needs are central to your care. This webinar explores practical strategies for self-advocacy, how to use storytelling to share your health journey effectively, and ways to clearly communicate your priorities so you leave your appointments feeling heard and feeling empowered. Leading the discussion today is the Foundation's Chief Medical Officer, Dr. Sneha Mantri. Dr. Mantri brings a deep commitment to improving care, advancing research, and centering the voices of people living with Parkinson's. She is an associate professor of neurology at Duke University and a nationally recognized leader in interprofessional care, health equity, and narrative medicine. Throughout her career, Dr. Mantri has remained grounded in the stories of her patients and passionate about helping them achieve what matters most. Please join me in welcoming Dr. Sneha Mantri.
Thank you, Krista, and thank you everybody for being here for this Parkinson's Foundation Wellness Wednesdays. As Krista mentioned, we're going to be focusing today on how to empower you as the person with Parkinson's in communicating with your clinical team, whether that's your movement disorders neurologist, general neurologist, primary care doctor, physical therapist. We know that people see a lot of different types of clinicians. And my hope here is that we can think about and talk about how you can best advocate for yourself and your needs across a variety of different clinical settings. And we'll practice and we'll give you some tools and tricks to help with that. So our focus today is going to be on the value of self-advocacy and optimizing your care with Parkinson's and your Parkinson's journey. We'll talk about ways to identify and adopt a shared focus and active partnership with your clinical team. We'll talk a little bit about how narrative medicine can be helpful in learning to share your story in a way that highlights what matters most to you. And we'll practice using short, focused statements to communicate those top concerns. And then lastly, we'll share some, again, practical guidance and a tool, a worksheet that will help to get you prepared for your future visits with your clinical team to make sure that you're setting the agenda and that your priorities are addressed. But we want to start actually by hearing from you. There's a poll that will come up in just a moment asking about your age range. And this is helpful to us at the Foundation because we know that we serve a wide range of people with Parkinson's disease and care partners. And we also know that different generations and different life experiences may view optimized care differently. So this will help us sort of understand, number one, who you are, and number two, how we at the Foundation can help serve you and your needs and the needs of your loved ones. So just take a moment to go ahead and answer the poll question. All right. So it looks like most folks are in the 60 to 79-year-old age range, although we have a number of people who are 80 and above, and several who are in the 41 to 59-year age range. So thank you for answering that poll. Again, it's helpful to us to sort of know where you're coming from and how we can help address your needs. All right, so moving into the Optimizing Care Initiative. This is a focus of the foundation, really trying to help folks make the most of their clinical visits and their Parkinson's care, which extends beyond the appointment time itself. Optimized care really starts with you and your voice. What matters to you? Because you're a unique person and Parkinson's is affecting you in ways that may be very different than the person sitting next to you in the waiting room. So this really brings the focus of the visit into or focusing around the needs of the person with Parkinson's disease and encourages shared decision making and partnership between people with Parkinson's, care partners, and clinical providers. We're going to be talking about ways to prepare before your appointments, how to engage with your clinical team during the appointments, and what you can do after the appointment to sort of follow through on recommendations or reach out to your clinical needs. We're going to talk about how to identify what matters most to you, how to track your symptoms, how to communicate your concerns as clearly as possible. And as that last bullet point kind of points out, we're kind of shifting our focus a little bit from a framework of what's the matter with you to what matters to you, what matters most, and how can your clinical team help you meet your goals during and between visits. This is really, I think, is a profound paradigm shift in the way that we think about clinical care for people with Parkinson's and for many other clinical conditions. It's really a shift from a clinician-driven format, what's sometimes called a very paternalistic format in healthcare of what's the matter with you, what's wrong with you, what's the matter, to a shared partnership in care and really encouraging clinicians to ask patients directly what matters to you and what can I help you with. But this also puts a little bit more of the burden, if you will, of decision making on the patient and their care partners to be able to communicate that as clearly as possible and as succinctly as possible. And that's a real skill. It's a skill and a muscle that you need to practice in the way that you practice any other skill. So learning how to become a self-advocate is, I think, critically important. Self-advocacy can look differently for different people, but fundamentally, it's the ability to, number one, understand what your needs are, to be able to articulate and speak up for what's important to you, and then to make active choices to live well and to recognize that everything that you do is a choice. You have the agency and you have the purpose in this partnership. So it requires a little bit of pre-appointment work, actually, stopping and thinking and really reflecting and writing down, what do I want from my appointment? What's my role in achieving that goal? And what are the barriers to that goal or potential barriers that I need to think about as I plan for my future? This is sometimes referred to as well as a patient activation, which is that kind of philosophy of taking primary responsibility for your care, to understand your why, if you will, like what matters to you, why are you doing this, why are you trying to achieve your specific goal, to focus on what you can do to get the most out of your visits, and conversely, to recognize moments when you're inactive and to be honest with yourself about why that happened or why you chose to do something or you chose not to do something else. Again, so this puts a little bit more, I think, of the emphasis on the person with Parkinson's disease and perhaps their care partner, in being able to, again, number one, understand what's happening, and also to articulate the pros and cons of different choices that you may make. To take your medicine, to skip your medicine, to exercise, to not exercise. Those are all fundamental choices, for instance, that people with Parkinson's are faced with every day. Um, those of you who may know me know that I am a storyteller at heart. And so I'm always thinking about the role of storytelling and narrative in care. And so it's, not just what you're saying, but how you're saying it that really, really matters to your clinical team. I am a movement neurologist. I see patients regularly in the same clinic where I've worked for many years. And one thing that I think all of us are aware of, both on the clinician side and certainly on the patient side, is that time feels like such a precious commodity in the clinical visit. We only have so many minutes and so many things that we want to try and cover. And so it can be really hard to be able to convey your needs in a way that your doctor or PA or NP, your clinical team, can really hear that and do something with that information. So this is a formula that I have found helpful when I'm talking with patients or listening to patients about what their needs are and what matters to them. It's called headline plus impact. And the way it works is to kind of have a core statement. So in this example here, the statement is, my biggest concern is sleep. And then the secondary statement is really focusing on the impact that that symptom has on your life. So my biggest concern is sleep because it leaves me exhausted and unable to participate in daily activities. So again, like really short and succinct, it's one sentence, but it tells your doctors so much about why this is an important issue for you. And it can be really helpful depending on what the impact is. It can be really helpful to us in making recommendations about, one medicine may have certain side effects, or one treatment may have certain concerns that we'd want to avoid. Or conversely, sometimes we use side effects as a pro and sort of kill two birds with one stone, if you will, and be able to address multiple issues at once. But the only way that we would know that is if you're able to tell us, not just here's the symptom I'm dealing with, the sleep, but why it's important. It's this person is exhausted and really struggles to participate in daily activities. So again, this is kind of a skill, this formula, and it takes some practice to get used to. So let's try it together. This is the interactive portion of today's talk. So what I want you to do in the chat is try to use this headline plus impact formula to share your concerns. So we've got the example formula up here. Again, my biggest concern is sleep. It leaves me exhausted and unable to participate in daily activities. And in the chat, try your own example. My biggest concern is X. It makes me feel Y, and I'm not able to Z. So fill in the blanks, if you will, and just type that in the chat. Um, and we'll see, is this something that people are comfortable with, are able to kind of practice and get a handle on. I know it may take a moment for folks to uh, add to the chat. Yeah, Krista, thank you for getting us started. My biggest concern is my mood. I'm not able to have fun, and it impacts my relationship with my spouse. I think that's a really, really great example, because if somebody just said to me, my biggest concern is mood, it would sort of leave me like, okay, what next? Like, what should we do? But being able to say, I can't have fun, and it's impacting your relationship with somebody else. So that really kind of elevates how important this is. And Marcia, thank you for sharing. My biggest concern is gait awkwardness. Oh, that's a huge one for so many people. It makes you lopsided. It makes me lopsided, and I'm not able to exercise vigorously. So again, like that tells us it's not just the immediate impact of the gait awkwardness, but the lopsidedness, I imagine, can throw people off balance, increase their risk of falls. That's something I'm always so worried about for people with Parkinson's. Um, and not able to exercise as vigorously tells me about, what your long-term disease progression might be with Parkinson's, because we know exercise is so important. From Susan, I see my biggest concern is off time, such a big challenge for so many people as I get stiff and it impacts timing with appointments and meeting friends. So I'm seeing the physical impact of those off times, but also the kind of social impact. Missing appointments or being late to things, being late to times with your friends, which is so important. So, oh, now I'm seeing a whole bunch of them coming in. I'm probably not going to be able to keep up as they keep moving on my screen, but my biggest concern is loss of taste. That's a profound one because, as Armitage says here, I'm not able to, where did it go? It makes me feel isolated. So that's social impact, and I'm not able to enjoy food, which is such an important part of sharing a meal with other people, or enjoying your meal on your own. I think that one is really interesting to me because loss of taste is not usually something, I'll venture, I guess, not usually something that your doctor might ask you about proactively. But it can have a huge impact on people's quality of life, as we can see. So that's, I think, a really great example of how this formula, the headline plus impact formula, can really help your clinical team understand what matters to you and what we can do about it. So thank you so much for folks who've put things in the chat. I think, a lot of the ones that I'm, just glancing over quickly are things that have a giant impact, or a huge impact on people's quality of life, but again, are not always things that clinical folks like myself might ask about off the bat. So a great example of that shared partnership between your clinical team and your own needs, and being able to advocate for your own needs for people with Parkinson's disease. So thank you everybody for dropping these ideas in the chat. I want to turn it over now to a colleague of mine, Carla, um, who is a care partner of her mother with Parkinson's disease. Krista or Carla, are you?
Yeah, I'd love to share a little bit about Carla, and feel free to fill in the blanks, Carla. Thank you, Sneha. And just a quick response to the question, slides will be available after our presentation today and the recording, so we'll get to be able to revisit these tips later on. So Carla, so pleased to introduce you as our guest presenter, recognizing that you've been caring for your mom since you were 15 years old. And your mom was diagnosed with young onset Parkinson's disease. And I know that over the years, you've balanced caregiving with a career in digital health and have, I want to say, naturally or organically become a very passionate advocate for caregivers, especially those who are younger caregivers and immigrant caregivers. You've brought so much awareness about the challenges that we face as care partners, and also the need for more support across healthcare and workplaces. Carla is also a member of the Parkinson's Foundation's People with Parkinson's Advisory Council, where she continues to elevate caregiver voices and champion education and inclusion within the Parkinson's community. So today, Carla is going to share a little bit about her lived experience and the insights she's gained along her journey caring for her mom. So please join me in welcoming Carla.
So hi everyone, I'm Carla Velastegui, and as Krista shared, I've been a care partner for my mom for about 16 years now. She was diagnosed with young onset Parkinson's disease. And having been supporting her throughout this journey, it's been a long journey full of ups and downs, trials and errors, and really trying to find a rhythm that can support her throughout this journey. And I know how overwhelming preparing for an appointment can be, especially when there's often so little time and so much that we want to cover. And so over the years, we've have learned to figure out some tips and some processes that help us prepare, that helps us communicate, and to help my mom stay engaged throughout those months that we don't see a provider. And what I'm going to share today is not a perfect formula, and it's just what's worked for us. And even if one idea resonates today, or if one thing feels like something you can try, that's already a win. So for us, we something that's become really, really important has been preparing ahead. So the preparation starts weeks in advance for us. We really begin tracking any changes, any medication timing, any side effects, mood, and really just jot down anything that stands out, anything that we think is helpful for the neurologist to know. And from there, we really try to add the context, similar to what Sneha shared, the context as to how do those changes affect my mom's day to day, so her routines, her comfort, her quality of life. And that way we make sure that this information isn't just data, but it's really a story about her day to day and how she's trying to navigate her management of Parkinson's. From there, we try to really focus our discussion. So a few days before the appointment, we will sit down together and I'll kind of go with her through, let's talk about what's been going well and what hasn't been going well so far from the past few months. And this is where we actually look at a lot of the notes and the data that we've been collecting over the past few months and weeks. And then from there, we try to decide what do we want and what do we need from this visit. So, are we looking for answers? Are we looking for reassurance? Or are we looking for new strategies and a new care plan? And that really helps us guide our points and it helps us be intentional into what we want to bring into the conversation. We then kind of jot down our top two, three items that are kind of that main priority that we want to talk about and really bring into the impact of her day to day and kind of help have those clear questions so that again we can help guide that really focused discussion as to what are we looking for from that specific visit. The next one for us has been really getting comfortable with speaking up. And so I know oftentimes advocacy can sound intimidating, but it's really just about communicating clearly and ensuring that my mom's voice is part of every decision and part of the conversations around hair care. So we share those observations, and it's become really, really important in our hair care journey for us to share her goals and her definition of quality of life, which are what guide those decisions. And so we make sure that those are coming through and not just her symptoms, but really those things that she enjoys and she wants to do. Um, and I want to remind us all that advocacy isn't confrontation. It's really about partnership. And so that kind of leads me to my next one, which is, we're truly partners and care with her providers. And so we recognize that trust takes time. And we build those relationships over time with my mom's neurologist, and that relationship has really grown into that partnership and kind of what Snake shared, that shared decision making. We share updates openly. We are transparent. We ask about options, and we listen to recommendations. And over time for us, that has really helped us kind of build that trust, build that kind of collaboration with her providers, and we really take into account and recognize that the appointments are just one moment in care, but that relationship is built over time, and having that communication, open and transparent communication, allows us to optimize kind of how do we best treat my mom and in her management of Parkinson's disease. Our next one, and I really wanted to touch upon this, especially for care partners, is really that idea of honoring autonomy. For us, it's really natural to want to focus on safety. We want to protect the people we love, and we want to do the best that we can to make sure that they're safe. But we have to recognize that person-centered care also means honoring the person that we're caring for. And so for me, that's become really respecting the term that's out there, the dignity, her dignity of risk. And so my mom's right to make choices even when those choices involve some uncertainty and some level of risk. And so, for example, for my mom, that may be deciding to stop taking a specific medication because it's impacting her ability to do activities that she truly enjoys and that bring her a lot of joy and really, really impact her mood and mental health. And so it's really finding that balance that we're not just managing risk, but we're really there to support my mom's independence, her dignity, and really that shared decision making with her providers and with me as her care partner and her. Um, and as we're wrapping up to the appointment, and as we're kind of ending those like quick 15, sometimes 20 minutes that we get, for me too, super important to make sure that we are clear on any next steps. And so before we leave the appointment, I always check in with my mom to make sure that we're understanding what's next. Is it medication changes, any follow-ups that we have to do on our end, any therapy that we need to find and reach out, and what are we responsible for? After you leave those appointments and you feel so flustered and there's so much that's coming your way, so that kind of having that clear plan helps us reduce the stress, avoid confusion, and then we're feeling a little bit more confident about what is coming for us and what's next over the coming months. And then that leads to the staying involved. So after the appointment's finished, there's usually weeks and months in between, and so we have to be active partners in care. So we're monitoring progress, we're monitoring any side effects to new medications, timing, changes in mood, anything that's new. But we're also really focusing on celebrating those small wins. So sometimes that could be the ability to now go for a longer walk or be able to participate in activities that my mom really enjoys. And so we're really noticing, okay, that's been a positive change. It's a small win, and we want to be able to share that when we see the provider again. But really thinking then we have to remind ourselves that appointments are just checkpoints, and so as we navigate the care of someone with Parkinson's, a lot of the progress really happens in between those appointments. So through that communication, through being consistent on our end and really transparent and real with ourselves, we find that it helps us kind of stay involved and engage. And ensure when we see her provider again, we're able to come prepared and feel a lot more confident. And so as I'm just closing my thoughts, I know that navigating appointments and managing the day-to-day of Parkinson's can feel overwhelming. And I've learned over the time, over the years with my mom, all these different tips and tidbits that have helped us really make those appointments into meaningful conversations and really build those relationships and that partnership with my mom's providers. And really, the Parkinson's Foundation's Optimizing Care initiative is a reminder to all of us that our voice is so important in the room, and that your experiences, your story, and your priorities are really what guide that effective partnership and care. So I hope today, out of these different tips, that something sticks with you, or that you're open to trying something, and that hopefully will help you feel more prepared and more empowered for your next appointment.
Thank you, Carla. Really appreciate the way that you support your mom and how your experience is now supporting so many. So thank you so much for sharing. And we'll kick it back to Sneha.
Yeah, I'll echo that. Thank you, Carla, so much for sharing that. And I really loved the way that you framed that relationship that you have with your mom and your mom's doctors. I think you said something like the appointments are checkpoints, right? They're these single moments or, intermittent moments, but there's a lot of stuff that you're doing to help support your mom before and after, during and after the appointments, right? Preparing for the visit, thinking about what matters and how to convey that. And then during the appointment, sort of balancing, as you said, her autonomy to make decisions about her medications and her treatments with the dignity and choice that being an adult entails. And being able to speak up and have a care partner as a support in those moments. And then after the appointment, to follow through on recommendations and, take the next step to, get yourself to therapy appointments or get yourself to exercise classes or support groups or what have you. And, Carla, you also pointed out the real importance of monitoring that progress in between appointments. I see patients, for instance, maybe a couple of times a year, maybe 3 times a year. But that's 3 days out of 365. And so for the other 362 days, people are, self-monitoring and taking those actions to live well, to exercise, to eat well, to go to their PT and speech and OT appointments. So it's really, really critical, again, not just what you do during the appointment, but what you're doing between appointments or after the appointment to kind of follow through on recommendations. Um, and so, oops, sorry, moved ahead too quickly. And so this is a really nice sort of checklist that we have at the foundation for thinking about what different tools for self-advocacy can look like. Using a pre-appointment checklist can be so valuable at helping you prioritize, again, what matters to you, and then to practice those statements, whether it's the headline plus impact format, or I want to travel to see a family member, or I want to go to my son's wedding, or I want to blank, right? Like that really helps set a really tangible goal for yourself and for your care team to help you meet that goal. What needs to happen so that you can, say, travel safely or go to the wedding safely. Keep your concerns short and specific, as concrete as possible, only because, again, I wish that we had the luxury of time in clinical appointments, but unfortunately, that's not the reality of how so much of clinical care is delivered. It's very short duration, kind of time crunch. And so keeping your concerns as concrete and specific as possible can really help your clinical team help you meet those goals. It can be so valuable to ask friends, family, companions, care partners, how they think you're doing. Because sometimes having that kind of second set of ears and eyes, whether it's in the appointment itself or ahead of the appointment or between appointments, but having that different perspective can sometimes really illuminate things that, maybe you thought were going really well, but your family members are, seeing something different, or vice versa. Maybe there's something that you think was not going so well, and your family members or your companions or your friends are like, that it's actually fine, like we can work around that. So again, it can really help you prioritize how to help your doctors meet your needs. And then lastly, if you don't feel heard in an appointment, it's important to speak up then too, because it's number one, really important for clinical folks to get that feedback. After we graduate from, medical school or residency, we very rarely get real feedback from folks about how we're communicating with our patients. And yet we can never improve unless we, get that feedback. So it's important to speak up, to ask clarifying questions, and to take responsibility for your care. These tips and a whole lot more are at this webpage, which is on the screen and in the chat, parkinson.org/prepare. And that kind of helps you walk through what all of these different things might look like. I do want to take a moment to highlight a new worksheet from the Parkinson's Foundation that our Optimizing Care initiative group has put together to kind of consolidate a lot of this into a single front and back worksheet. If you scan the QR code, or again, go to parkinson.org/prepare, or click the direct link. Thank you, Brianna, for putting it in the chat. You'll be able to get a downloadable version of the worksheet, which you can print or save to your computer and show your clinical team when you meet with them. The first page of the worksheet kind of walks you through a lot of those steps and symptoms. And then the back, part two, is really kind of trying to narrow it down to like, what are those top 3 things that you really want to get across? And then practicing those headline impact statements or I want statements, depending on the type of thing that you want to get across. So it's a really helpful guide. I encourage you to use this if you can. I will say that as a clinician, I love getting, things like this from a patient because number one, it can help us really sort of focus the agenda for the visit and make sure that a person's concerns are addressed. And I'll often, if somebody hands me a physical copy of this, for instance, I'll get it scanned and uploaded into their clinical chart. So, the next time they come back to see me or my physician assistant or one of my other colleagues, that person has access to like, hey, this is what we talked about, and here's what the person kind of set as goals for themselves. So it's a good way to sort of check in and keep yourself honest, if you will, and keep your doctor honest about are you meeting your goals from visit to visit and between visits. Um, so again, the whole sort of focus of the Optimizing Care initiative is to help the person with Parkinson's feel empowered to speak up for what they need. It's a very individualized thing, good care for Parkinson's, and it really depends on your voice and your story and your priorities. And success is really about sort of transparent communication between you and your clinical providers. So it's important to be honest and to be clear about what's bothering you. It's important to share your priorities and preferences. And this is the part that's really on us as clinicians, is to make sure that the patient, the person with Parkinson's, and or their care partner can feel heard and understood in the visit, and can have that kind of open two-way communication. We talked a little bit about the concept of patient activation, which I think is really key here. It's all of that follow through between visits to make sure that you're kind of achieving your goals, working towards your goals, meeting your goals. And then if your needs aren't met, again, speak up, tell if you feel comfortable and safe, please give the person feedback about why the communication doesn't seem to be working. You can always seek a second opinion. I always encourage my patients to get second opinions, even if I'm happy with their care and they're happy with their care. Sometimes good to get another set of ears and eyes on things again. And then remember, the Parkinson's Foundation Helpline is a tremendous resource for all people with Parkinson's disease and their care partners. It's staffed by live humans during business hours. It covers kind of the entire country. It can be really helpful at helping you find resources in your community, helping connect you with other groups or support networks, and so on. So I encourage you to call the helpline if you're finding that you're not getting anywhere with your local groups. And thank you again, Brianna, for putting it in the chat. There's the website for, the phone number for the helpline, and then the email address is helpline@parkinson.org. So, in summary, I just really want to encourage everybody to remember that your story matters, your voice matters. We can't take care of people well unless we know what matters to them. And so that's why you'll be hearing this kind of language, I think, more and more in clinical visits. What matters to you? How can we help you? What can we do? And optimizing care begins with you. You are the one who has the choice. And I encourage you to exercise that choice and make good choices to live well with Parkinson's. We've got the worksheet, on the website, and then more generally on the website, parkinson.org/prepare. Is a wonderful resource for some of these tips and suggestions that we've talked about here today. And so with that, we're happy to take questions. I think Krista is going to moderate for us. So thank you, Krista.
Great. Thank you, Sneha. So for everyone who's still with us, please feel free to submit a question through the Q&A feature here on Zoom. And for those of you streaming on Facebook, type it into the comments and we'll be sure to answer those. We have a team that's helping support translating the questions through different devices. So, Sneha, there's this question that has come up from one of our care partners. And it's one that we're really going to dive deep into for Care Partner Summit. But since we're here and we're present, I'd really love to bring the question up for you. And Carla, this could be something that you could also tap into as well. So, one of our viewers is asking, how can I be heard as a care partner without undermining the needs of my loved one with Parkinson's?
Yeah, that can be a really tricky situation sometimes because you don't want to kind of take away, the voice of the person with Parkinson's, the airspace or the time. But at the same time, you as a care partner have very real needs and a very real perspective. Some of the things that I recommend or I sometimes do in my clinic is, communication over the patient portal, whether that's my chart or another, method, to be able to convey, usually that's great for like quick or short updates. For more involved things, or concerning symptoms that you may not want to share in front of, the care partner may be noticing symptoms that they don't want to share openly in front of the person with Parkinson's. An example of that might be if the person with Parkinson's is starting to see things that other people don't see or hear things that other people don't hear. There can be a lot of fear and stigma about bringing that up. And so sometimes care partners really struggle with like, how do I tell the clinical team that, my loved one is experiencing this? Sometimes what we'll do is have an opportunity to, I might meet with the patient while my social worker meets with the care partner and get some information from them, or another member of our team meets with the care partner and gets information from them. And then we sort of swap, if you will. We also make good use of like things like index card comments or questions, and then follow up phone calls to help support things afterwards. So that's something that we've been using in our clinic that seems to be working well. Carla, I'm really curious to hear like what your perspective is as a care partner on this.
Yeah, I think, I mean, as a care partner, it can be often difficult to bring up points in those appointments. But I would say something that I've tried to learn is to really keep it factual and respectful. I will bring it in as, from my perspective, I'm noticing this, and this is how it's impacting this part of your life or this part of your ability to go on a walk or to this activity. And so it kind of separates it from my mom feeling like I'm, kind of attacking her or sharing something that doesn't want me to share, but it's very much like this is a factual and I'm sharing it in a respectful manner with the provider. And I find that has really helped. And similar to what Sneha shared as well, sometimes that might also include like asking, okay, the provider, oh, I just want to share something really quick with you in private. Could I have, a minute or two to be able to have that conversation, or make a note in the patient portal, or even have a phone call with the kind of the admin or the nurse in advance to let them know where I'm noticing these changes. I was hoping that the provider will be able to help me bring it up. And I find oftentimes as a care partner, sometimes having a third party bring up kind of symptoms that we're seeing, or changes that we're seeing sometimes eases a bit of the receptiveness of the person living with Parkinson's to be able to chat about it. So I think that's something else that we can use as well is kind of using that third party to then open the conversation and then kind of share again those factual in a factual way and in a respectful way.
I'm hearing a lot of what we've shared today is really building communication skills with ourselves and with others. That includes our companion, our spouse, our friend, our family, and our providers. And communication is certainly a skill that we practice. And Carla, you're a really beautiful role model for how to communicate effectively, respectfully, and the various parties that we do choose to have relationships with, whether that's mom-daughter relationship, daughter-provider relationship, and so on and so forth. So really want to acknowledge that that's what I'm hearing here is communication skills. Yeah. Speaking about communication, another question from one of our audience is asking, how do I communicate my non-motor symptoms to
Mm,
my provider?
yeah. Oh, that's a great question because non-motor symptoms I think are really often the biggest drivers of quality of life. Even just looking at the things that people were writing in the chat earlier today, so many of them were non-motor symptoms. And I think it's something that, historically, clinical folks like physicians, movement specialists, other, clinical folks weren't great at asking about. I hope that is changing as we are making more of a push towards educating clinicians around the impact of non-motor symptoms. But there are also questionnaires that you can fill out and bring to your providers. So the one that I am the most familiar with is the NMS Quest Non-Motor Symptoms Questionnaire. And I believe it's freely available now, but it asks about the frequency and severity of a number of different non-motor issues, like constipation, pain, sleep, mood symptoms like depression, hallucinations, all of these things that really impact people's lives, but historically were not kind of recognized in the same way as the physical symptoms can be. And so sometimes having, again, as part of your preparation for your visit, taking a moment to fill out a questionnaire around non-motor symptoms and then bringing that to your clinical team can be very helpful to highlight for them, like, oh yeah, like sleep is like a really, really major problem right now. Or, depression or apathy is a really major problem. Like, let's do something about it. And that can open up the conversation for, whether it's, mindfulness training or medication adjustments or what have you. But it can be a really nice, not neutral, but like a objective way almost of being able to say, like, this is something that's impacting me, and this is how severe it is. Like, I'm scoring 30 on this questionnaire. And then that also, the reason why sometimes those questionnaires are nice is because then you can, make some changes and then compare 6 months later, like, has this led to a real difference in the severity or the frequency of your sleep issues or your constipation, what have you.
Krista, something else that I quickly just wanted to jump in and share. I think that's where it also helps to track over time. So, I think we all have like challenging days sometimes, and you may think, okay, that was just a one-off, but that's when, when we're seeing it happen, reoccurring and a lot more often. And when we actually look back and realize, okay, maybe mood has really been impacted significantly more, or, maybe some non-motor symptoms we're seeing it occur a lot more often, then it's something that when we go and prepare for the appointment, we can bring it up and mention it's actually happening significantly more than it used to before. And so that's where that tracking and documenting those things really, really helps from like a care partner and person living with Parkinson's perspective.
Yeah, Carla, thank you for that. It reminded me of our previous conversation where you were sharing how you partner with your mom and her providers, and what came to me was you're collecting data essentially over the months of time between visits. You're collecting data and recognizing these patterns so that you can come from to these appointments with a place of knowing, versus showing up. You also mentioned. Today might be a good day when you go and visit the doctor. Your mom is doing really well, but over the course of the 6 months between doctor visits, that may not be the case, the overall tone, and what these patterns, this data that you've been collecting. So I appreciate you reiterating that the tracking of the days and the moods and whatever symptoms are really impacting. I want to visit a comment that Joseph wrote when the chat was open, and it comes back to this idea of communication. Um, they rate that their person with Parkinson's says, "Don't tell me, I don't want to know. I don't want to know what you have to share." And that this is really difficult for them. And so he's asking for some kind of resource or suggestion, perhaps some advice on how to manage a relationship with someone who doesn't want to acknowledge or know the experience that the care partner is having.
That can be, I think, really hard because, like I said, the care partner often has such a valuable perspective to bring, but at the same time, the person with Parkinson's is sort of, in a lot of ways, and should be sort of in the driver's seat, to use an analogy. of this, this bus. Actually, that's a really apt analogy because oh gosh, this wasn't a Parkinson situation. It was a different medical condition, but I heard somebody use that analogy to say that, their father was very, very sick with a particular condition. And the rest of the family was really distressed about how things were going, but the dad, for whatever reason, personality, not wanting to denial, stoicism, didn't want to bring up certain, concerns. Um, and the daughter said something along the lines of like, well, Dad, you might be driving the bus, but the rest of us are on the bus. And if you crash, we're all going to crash with you. And I thought that was a really powerful way of expressing it. And it really helped the father, I think, understand the impact that his, not wanting to engage with certain conversations, that the impact that was having on the other family members. So that's one, I think, possibility. I think the other thing is, continuing to sort of be there for the person with Parkinson's, even if it seems like they don't want you there, because sometimes it's, Carla, you can probably also speak to this. Like I know this has happened in my own family, again, not with Parkinson's, but with other conditions, that the person who is sick, or has a chronic need doesn't want to be seen as needing help from other people, but they really, really actually do. And it can be really powerful to kind of keep being there for them, even if they, seem like they're pushing you away.
And I think just to like add on to that, I think it's also the idea of, it can be hard to watch someone you love and maybe not be open to wanting care, but I think it's helpful sometimes to have those conversations after the episode or after the situation when you're in a calmer space. And so, for example, I'll share with my mom a personal example. For the longest time, she didn't want to use a walker. And we had like a fall in a few episodes. And after that, we kind of chatted and I shared with her, like I'm really concerned, kind of really similar to that analogy. I'm really concerned kind of about you falling and while it's your choice and it's your independence, it does in a way have an impact on me. And so what are the risks? Like what are you worried about? And really trying to understand kind of like the core as to what is it? Is it they're scared? Is it they're worried? Is it they don't have information and trying to kind of support that? And you're not coming as a confrontation, but coming more from a conversation. And I really want to emphasize on being objective. Like we're not coming here to attack that person that we care for, that we love, but it's more like when this happens, I'm seeing this and that impacts this. And so how do we kind of start opening the door and really understand like where is that concern or that worry or that quietness coming from, and how do we support them in getting information or being informed or feeling more confident about it?
I appreciate you both answering the question that's challenging to answer. This is it can feel like we're walking on eggshells sometimes when we're trying to be our most authentic and compassionate selves. And Carly, you bring up a point of tone. The way that we choose to speak to one another, and how that tone can shift when it becomes a sensitive subject that we're exploring as a team, whether that's mother daughter or husband wife or friend sister, whatever the dynamic is. These conversations aren't easy. And it's important to acknowledge that. And that's what you started with, Dr. Mantri, was this isn't the easiest conversations to have. And it's important that we do have them, recognizing that the tone that we step into really has an impact on the result of that conversation. I want to ask, John wrote in here, how do I know if my doctor is up to date on new developments, treatments, and medications? So Dr. Mantri, if you could just answer that one for John.
Yeah, of course. So there's a couple of different ways, both to check, things like certification status. You can look at the boards essentially. For neurologists, it's the American Board of Psychiatry and Neurology. And if you go to that website and put in a person's name, you'll see if they're certified in neurology, if they're up to date on their certification. We have regular, requirements that we have to meet. So that's one very kind of basic, I think, certification to double check. that somebody is up to date on their maintenance of certification. Specifically around, new treatments in Parkinson's care or Parkinson's work. Um, you can ask. I would never feel sort of, um, uh, what's the word? Annoyed about a patient asking like, hey, have you heard about X treatment, X trial, X condition? I read about this on the Parkinson's Foundation website. What do you think about this? Because I think that's a really nice opportunity to, number one, open up the door to something. And number two, it's important to keep in mind that not everybody is going to be able to be up to date on the exact medical literature or the exact, press releases that are coming out. I remember even in my case, I had a conversation with a patient who I was seeing in one afternoon who wanted to talk about a, big press release that had been posted by a drug company earlier that same day. So I hadn't read the press release because I was seeing patients all morning. And so I wasn't, so I would say that, it's not a concern per se if your doctor or care team hasn't read the latest article on something. I think what would be a concern is if you bring it up to them and they say, oh, I don't care about that, or I don't need to know that. So it's more about, I think, the person's response to bringing up, new therapies or potential new data. Another place that you can also look, which is again sort of an open database. It's not perfect, but Medline is a centralized hub for all or the vast majority of studies that are published. So if your care provider is in an academic center, for instance, and maybe publishing on research studies, that's another space to look to see kind of what their topic areas are and what areas they're kind of most interested in researching and being sort of pushing the needle forward that way. Not everybody's in an academic center though, so that's why Medline is a little bit less useful for certain types of providers.
Thanks, Dr. Mantri. We're just at a moment until our webinar is timed to end. So curious, Carla, if you have any final words to share with our community before we close out on the importance of preparing for your appointment, advocating for yourself, and yeah, any specific experience or wisdoms that you'd like to leave us with.
I would say it's a trial and error, and you have to find kind of what works best for you, find that flow, that process, and work on that communication. Again, it's for mom, it's been 16 years for us of trying to navigate this, and for some that are just starting your journey, it may just be one step, and that's okay. So really be patient with yourself and realize that it's a building over time, and you figure out that relationship. But remember, your voice is at the center of care. Your voice is at the center of your journey navigating Parkinson's or supporting, and we as care partners are there to support the voice and advocate for the voice of our loved ones.
Thanks, Carla. Dr. Mantri, any final words?
No, I would just echo that. I think, sometimes we hear or see this analogy of the patient at the center of the solar system. The patient is the sun, and then all of these other folks kind of around them and orbiting the patient. And I think that's a really powerful way to put it.
All right. Well, many thanks, Carla and Dr. Mantri, for sharing your time and your wisdoms with us today, and for all of you who were open to the idea of how to expand this muscle that we call the voice. So I really appreciate the time that each of you, Dr. Mantri and Carla, offered us today, and all of you for sharing your presence. If you had a question that went unanswered or a comment that wasn't read out loud, feel free to call our helpline at 1-800-4PD-INFO. They're rigged with all kinds of comprehensive Parkinson's support, virtually in your area or not. So please do not hesitate to reach out to our helpline. And finally, a reminder for our annual Care Partner Summit. This year's theme is Caring with Confidence. There were a lot of care partners present in our presentation today, so I really encourage you to come to our Care Partner Summit on Saturday, November 8th. The website's there on the screen, parkinson.org/care summit. And again, please do not hesitate to reach out to us at parkinson.org, email our helpline at helpline@parkinson.org, and the phone number is there on the screen. We're here for you and really grateful to be able to have the chance to chat. So thank you for joining us. Dr. Mantri, thank you for your time. Carla, thank you for sharing your wisdoms. Until soon, friends, may you be well and may you be at peace.